Hi, everyone, and welcome to Black Health Conversations, HIV prevention for Black women. My name is Paula Wheeler, and as you probably already know, I'm one of the four co-founders of Black Health. And this topic is really special for me because learning about HIV and volunteering as an HIV test counselor is what got me into public health and global health. And so, outside of the work I do with Black Health, I also currently help manage a national HIV program in South Africa. So I'm really passionate about realizing health equity for Black people everywhere. And HIV is one of those diseases where racialized health disparities are extremely stark. I believe to be effective in this field, you have to be working to dismantle systemic racism. And with that, we're so glad that you have joined us today to discuss this important topic. And I truly hope that you walk away with helpful new knowledge and information to share with your community. And I really don't doubt that you will, since we have two amazing guests who work with the CDC's Let's Stop HIV Together campaign, Dr. Oni Blackstock and Rymsky Evans, who will be able to speak in detail from their clinical and community-centered perspectives about how HIV currently affects Black women and the tools we have available to end this epidemic. I will introduce our guest speakers shortly, but first we want to take a moment and just celebrate us. It's Black Girl time. So we're going to do something really nice, really classy, and we are going to open this conversation with a performance by acclaimed poet Ashlee Haze.
Hey Paula, thanks for having me.
Hi, Ashlee. Thank you for being here.
I'm excited.
So, to introduce Ashlee with her bio. So, Ashlee Haze is a poet and spoken word artist from Atlanta by way of Chicago. She is a three-time Queen of the South Poetry Slam champion, two-time Women of the World Poetry Slam finalist, two-time National Poetry Slam semifinalist, and the 2011 Southern Fried Poetry Slam team finals champion. And she recently appeared on NPR's Tiny Desk alongside the Queen and Slim composer Blood Orange, which is so cool. So, welcome, Ashlee. Thank you for gracing us with your presence, and I'll let you take it from here.
Thank y'all so much. What a joy to be here amongst Black women and Black femmes, and to be having this conversation about our health and to celebrate us. So, to do that, I'd like to start with this poem. It is called Self Reclamation in Three Parts. And reclamation is the act of taking something back. And so, as I was writing this poem, I was taking myself back from other people's definitions of what it meant to be a good woman, or what it meant to be a bad woman, or what it meant to be ladylike. I decided that I wanted to define those things for myself. And so this is self reclamation in three parts. One, I was told that my body is not my own, that it belongs first to God, then to my father, then to the man who he gives me to. My father is dead. So, who is the rightful owner of this body now? I'll offer my body to a lover as if it is something that is not mine. But have you seen how people treat things that are not theirs, too? I log on to Facebook. I see a meme that pictures a scantily clad Beyonce beside a head wrap donning Erica Badu asking a question. Why be eye candy when you can be soul food? Like I can't multitask. Like I won't get drunk in love, then tell you to call Tyrone. Like I won't read Coldest Winter Ever and Citizen before lunch. Like I didn't twerk across the stage to get my degree. Like I ain't write this poem to the tune of Bodak Yellow. Like I needed another serving of respectability politics. Or another person who can't be bothered with the woman's feminism but knows how she ought to conduct herself. Like I got time for people who shame women's sexuality in public but consume it behind closed doors. Let me be clear, ain't nobody got time for that. Three, what a time to be woman. The way we show up for ourselves, the way we dare to be visible, the way we snatch our stories back from anyone who dares to co opt them. The world is not kind to any woman who is confident in herself. My spirit quakes as I watch my friends explain consent to grown men. Then I have to see women shame other women for what they wear. Listen, feminism allows modesty. In the same way it allows me to wear whatever I want. I am here as a woman to reclaim all the parts of myself I was ashamed to get to know. Here to proclaim myself as a woman who is both and not either or. And to speak on behalf of the women who are only either. Let me be clear. A woman who is only either is still deserving of your respect. But as for me in my house, well, I can be eye candy and soul food because I know how to multitask. Thank you all so much.
Amazing. Okay. Snap, snap. Yeah, I was back here backstage snapping. Yeah, Ashlee, that was excellent, beautiful, inspiring as always. And
Thank
so
y'all
now
for
that I
having
have,
me.
thank you for, now that I have all of us here, I just want us all to be here to kick off this event. I just want to reiterate how important this topic is for the women in our community, the women who look like us, because Black women are still being hit very hard by the HIV epidemic, and we're often overlooked in response efforts. And just as an example, recent data shows that Black women account for nearly 60% of new HIV infections in women in the US, although we're only 15% of the female population. And we will talk more about why that is. But Black Health's favorite answer is it's racism. And in this case, it's sexism as well, along with a host of other structural disadvantages that Black women face day in and day out. So I just want to thank all of you for being here today and being a part of this effort to prioritize Black women's health. So we'll say bye to Ashlee for now and just get right into it with Dr. Blackstock and Rymsky. Okay, excellent. So I'll go ahead and introduce our featured guests by just telling everyone a little bit more about who they are and their backgrounds in this space. So we have Dr. Oni Blackstock. Dr. Oni Blackstock is recognized as a key thought leader and influencer in the areas of HIV and health equity. She is a primary care and HIV physician, researcher, and the founder and executive director of Health Justice, a consulting practice that provides racial and intersectional equity expertise to health-related organizations. Dr. Blackstock also served as Assistant Commissioner for the New York City Department of Health and Mental Hygiene, where she led the city's response to ending the HIV epidemic. She holds degrees from Harvard College, Harvard Medical School, and Yale School of Medicine, and is passionate about ensuring that all individuals and communities have the resources and support they need to achieve optimal health and well-being. Thank you for being here, Dr. Blackstock. We also have Rymsky Evans. So Rymsky is a Jacksonian from Jackson, Mississippi, and an HIV advocate who is leading in her community as a woman living with HIV. Rymsky currently serves as the state lead for the Positive Women Network and as a community advocate on the Mississippi HIV Planning Council. She also serves as a community member on Black Treatment Advocates Network, Mississippi, and the Mississippi Center for Justice, the Justice Advisory Council. Rymsky is the founder of Beloved Inc. Mississippi, an organization for women and girls living with HIV. And Rymsky is thriving while continuing to be an agent for change. So just to both of you, thank you so much. And I want to just give you both like individual thank yous. So Dr. Blackstock, I'm so honored to be in conversation with you today. I've been following you on Twitter for a while, as have a lot of people. And I was really excited when you launched Health Justice. Your voice in the space has just been so important throughout the past few years.
Thank you
and
so
really,
much.
yeah, and really vital to keeping health equity at the forefront of the public's attention. And there are a lot of similarities between what you're doing with Health Justice and what we're doing over here at Black Health. And I'm so motivated and I feel so affirmed to see others really coordinating their genius and their talents around dismantling racism. And Rymsky, I'm honored that you joined us, and I look forward to hearing your perspectives as someone who is living with HIV and as a true advocate for the community. As we all know, HIV stigma and the misconceptions around having HIV, they're so deep in our community, and it contributes to our people not even wanting to be engaged on this topic. And then they don't even know what kinds of services and care are available. There are a lot of people who have HIV and they don't even know it. And some people are going to be diagnosed with HIV in their lifetime. And I want those women to be encouraged to get treatment and be hopeful for what lies ahead on the other side of that diagnosis. So you being here and being able to speak about your lived experiences is so invaluable for all of us. So yeah, we can go ahead, we can get started. And I just want to start with a little bit of, describing the current picture of HIV for Black people and Black women in particular. So Dr. Blackstock, do you mind telling us more about the disproportionate impact of HIV within Black communities and how Black women in particular are affected?
Sure. And thank you again, Paula, for having me. I'm really honored to be in conversation with you and with Rymsky on this really important topic. So we know that Black folk have been disproportionately impacted by HIV actually since the beginning of the epidemic. It actually wasn't necessarily detailed until maybe about 5-6 years into the epidemic that Black people were overrepresented among people living with HIV. People also don't know that the first known case of HIV in the United States was a young man, Robert Rayford, who was diagnosed in the late 60s. And his story has basically been erased. So it's really important to understand the ways in which this has impacted us from the very beginning, despite sort of this framing of HIV initially as a disease only affecting gay white men. I should also say that Black women, a Black woman was among the first heterosexual women diagnosed with HIV at the beginning of the epidemic as well. And we've seen as the HIV epidemic has evolved that Black and brown people have been even more represented among new cases of HIV. So I think you had mentioned earlier on that, Black people, we account for about 13-14% of the population, but about 42% of new HIV diagnoses. And then similarly, I think you had mentioned for Black women, although we account for 14-15% of the female population, we account for almost 60% of new HIV diagnoses. And I honestly can't think of another medical condition that has such stark inequities. I don't think high blood pressure, diabetes, I don't think we see it with any other sort of chronic medical condition. So HIV has definitely been something that has impacted the Black community on a level that is quite different from other communities.
Yes, for sure. And yeah, I didn't know that about Black people and how they were affected early on in this epidemic. And yet with those stark disparities, it's hard to work in this field and not be pushing for health equity and health justice.
Mm-hmm.
So yeah. And Rymsky, I'm wondering, what are some negative impacts that you've seen working in the community on Black women in particular? What are some of the challenges that they're facing?
Well, I want to first thank you all for this great invitation and being a part of this conversation, especially when it comes to Black women, because Black women, we have really been forgotten. The history, of course, as Dr. Blackstock spoke about, it always had been about gay Black men, and even today, it's still about same gender loving men. And so, Black women pretty much have just been forgotten in the conversations that we have not been informed and educated the way that we should be,
Hmm.
especially in the South. And so it has greatly impacted Black women, and even to the point of educating them and getting them to understand because they only think that it's only for same gender loving men.
Exactly. Yeah, yeah, we are definitely very overlooked, particularly when it comes to things like PrEP. And what about we brought up the South? So what exactly is going on in the South that's different than the rest of the United States? What are some of the unique barriers that Black women in the South are facing when they seek out HIV services?
Well, when it comes to HIV services in the South for Black women, I think about where I am in Mississippi, especially in the rural areas of the Delta. A lot of the services are not available, and most of the services are available in the capital, Jackson, Mississippi. And so women are having to travel hours just to get to care, just to even get to some type of HIV services, so transportation is one of the barriers for that. Also, low pay wages. Mississippi has a low pay wage racket, especially for Black women. And this is something we are actually advocating and fighting for right now. And with that being said, having low pay wages, there's no affordable health insurance. And so if you're not with a job that with some benefits and you are on a regular job
Mhm.
without benefits, there's no way for you to get health insurance. So that's another barrier for Black women in the South when it comes to HIV services. And lastly, we know we have a lot of mothers out here. Um, and childcare is another big issue. Not having the services of someone watching your child, helping you, and that so that you're able to go to a clinic to be able to get what you need and that and so forth. So those are pretty much the biggest barriers, yet alone poverty itself, that keeps women from getting HIV services.
Yeah, and just to add on to what Rymsky said, yeah, no, I think that's such a comprehensive list of barriers that women in the South are facing. And just to speak to the point that Rymsky made about, health insurance, when we think about like the Affordable Care Act, which helped to expand Medicaid in a number of states, there's still about 7 states in the South that have not expanded Medicaid. And by estimates, expanding Medicaid would actually disproportionately benefit Black people and Black women. And so the fact that Medicaid hasn't been expanded, is definitely a huge barrier to women being able to access HIV prevention, testing, and other services. And then again, to Rymsky's point about caregiving, many times there's a number of research studies that have been done. I know Rymsky may know from her own experience and experience of peers, but many times we will forego our own care because we're taking care of a loved one or a child, and that often gets put in front of our own health and well-being.
Yeah, that's so true. And I think for like the last National Black HIV/AIDS Awareness Day, Black Health, we made a post that talked a little bit about like racist policies and practices that are affecting HIV for Black communities. And one of them was this coverage gap that you just mentioned, Dr. Blackstock and Rymsky, that you touched on as well. Just Medicaid wasn't expanded in a lot of states, and those studies have shown that those are the states that have like the highest like levels of racial resentment. So there's this direct link between racist sentiments in populations and those states not expanding Medicaid to cover those people who can't afford healthcare. And so 3 out of 4 Black people, I think 3 out of 4 people in the South who have HIV are Black, is the statistic. And so we see directly how like Black people in the South are like disproportionately impacted by HIV. And then if they can't get access to healthcare, I mean, that's step one. So, getting tested and getting treatment. So it's definitely a problem, this access to healthcare. And Rymsky, I wanted to know more too, just about like your own like personal journey with your diagnosis and how that has been for you. And if you also wanted to talk a bit about like, have you experienced stigma and how that has worked for you in your life, and how do you deal with that?
Yes, Paula. In the year of 2016, I was actually diagnosed with HIV. After being told that I was diagnosed with HIV, I pretty much was sent home to deal with this issue. Um, but after that, I actually got into care immediately, and began to get on my meds and get to a good place of you equal you under untransmittable, so it's been a wonderful journey. But now when I first started out, of course, there was the first 2 years of me having to cope with this, and deal with it. And so there was things that I had to deal with when it comes to stigma and discrimination, especially as a woman with HIV. I had an incident where I had to go to the hospital because I was having allergy problems. And before I was HIV positive, I actually dealt with a lot of allergy problems. But I went there to try to get some care, and I was told that because they knew I was HIV positive, they actually sent me back to my own doctor, my HIV doctor, to get the meds that I needed at that moment. And so, I look at the issue, that when people with HIV having to go into clinics and hospitals for various, you know, conditions and situations they may have with health, it's always addressed back to HIV, as if HIV is the thing that causes everything to be complicated with our
Mhm.
health, and that's not always the case. Um, the stigma part of this thing is pretty much just people not understanding HIV, and looking at you as if you are a person that can transmit, and not having an understanding the
Mhm.
facts about HIV. And so we have to deal with those things when it comes to stigma. But I just feel like if we educate people more and people get an understanding, that it can be better in that form. But there was also internalized stigma for myself,
Mm.
that I dealt with, because I was thinking that if I drunk water and my child drunk behind me, that I could transmit, HIV, because I didn't
Mhm.
even understand and have the knowledge of it myself. So there was a lot of different things that I dealt with, but in the same time, I began to thrive and take back my dignity, and knowing that HIV was not a death sentence, and that I would live long with this. And so today I'm thriving, taking my meds once a day, and just keep educate. I'm continuing to educate people about it. So it's been a good role for me.
That's amazing. Yeah. That's so important, like, for our people to know that it's not a death sentence. I think that, a lot of us, just because of lack of, like, education around this topic, like, the information is just really it seems like it's not getting to people a lot of times, the people who need it. But, a lot of us are still, thinking about HIV from those early messages from the 80s and 90s, and think that
Yeah.
we're still in that space, that the treatments are still there, and that there isn't much that can be done when you are
Mhm.
diagnosed. So people kind of, like, bury their head in the sand about it. They don't want to get tested, they just don't want to know, when there's so much that can be done. And Rimsky, you said you take your medication, did you say once a day?
Yeah.
Yeah, like, you take, I think a lot of people are still thinking, remembering, like, the cocktail of medications, and so
Yeah.
they're like, I don't want to take all those pills.
Mhm.
And so they don't know that there are a lot of different options. And yeah, you can live a full life. I don't know, Dr. Blackstock, if you want to, like, maybe speak more to that. Just what does it look like to be, the options to be diagnosed with HIV, the different services that are available, treatments
Mhm.
options available.
Yeah, sure. Yeah, and I just wanted to just say back to the last points that you all were making about just people not like being up to date on like where we are now in terms of HIV being a chronic medical condition. Some of that's also related to the fact, like for instance, like sex ed in school, like a lot of that has
Mm.
not been
Yeah.
updated with the new science. Rimsky mentioned undetectable equals untransmittable. So the idea of of someone living with HIV who's taking their medicines and undetectable and suppressed viral load, they're effectively at no risk of passing HIV on to their sexual partners. But this is not something that young people or most of the general public is learning, and so we really need to have like comprehensive sex ed. And here in New York City, we had an undetectable equals untransmittable campaign for the public so that people are aware of these sort of new scientific developments, and that people living with HIV who are taking um, medications can be very, very safe sex partners. And so just in terms of, yeah, so folks need to understand, like, we have, wonderful tools in terms of treatment. Testing is really the gateway to sort of enter into HIV prevention or treatment services. And then for prevention, there's a whole prevention toolkit, condoms, female and male condoms, but also PrEP. And we know that for those communities that are most impacted, particularly among Black women, that I think there's an estimate, I think 7% of women who are eligible for PrEP are actually taking it. So there's like so much more work that we can do in terms of, letting women know what their options are. Like PrEP may not be for like all women, but all women should know about it and should be supported in accessing it if they so desire. So the reality is, I think, as you were saying, there are the tools that exist, but because of some of these barriers that Rymsky mentioned, that you, Paula, mentioned, it can be hard for folks to really take advantage of these tools.
Yeah, I'm so happy you mentioned PrEP, because that's another thing, like, that would be great to have in sex ed, and, updating that education that all of us are getting, because people do not know what PrEP is. So, Dr. Blackstock, can you please tell us what PrEP is?
Sure. PrEP is a once-a-day pill that people who do not have HIV can take to substantially reduce their risk of acquiring HIV. And so there are, for cisgender women, so women who were assigned female at birth and who identify as women, there's one pill called Truvada that is approved for PrEP. And then there also, in December, was an injectable form of PrEP that can be taken every other month that was approved by the Federal Drug Administration, which is like really awesome, because often, it's really helpful to be able to have options in terms of how you take your medication. And we know, for instance, with like contraception, being able to take a pill or a patch or a vaginal ring, being able to use different forms of contraception can be really helpful, so people can decide what works best for them. And so for PrEP, now we have the second option that women can take to prevent HIV infection. And just to say, there aren't really any other tools that women can take without their partners knowing or needing their partner's sort of like agreement. So for instance, like male condoms, you have to get your male partner to put it on. And female condoms, if you're wearing a female condom, it's hard to hide that from your male partner. So if there are issues around safety and coercion, PrEP is really great because it's a user controlled prevention tool.
Yeah, I think that's an excellent point, something I didn't even think about. But I also really liked how you kind of made that analogy to the birth control options. Because one thing, when people ask me about PrEP, I always say it's kind of like the equivalent of birth control for HIV, like it prevents it. Yeah, so I'm happy that that still works too, with like the different options that are available. So that's really cool, actually, to know that there's the injectable has been approved.
Yes, and then just to say, for those who are watching, the Let's Stop HIV Together website has a special page. They have a campaign called She's Well. So the website is running at the bottom of the page, and then you can just click on the menu for HIV prevention, and it'll open up a link to the She's Well page, and it has information about PrEP specifically for women. So questions around, is it safe for breastfeeding, while taking different forms of hormones, when someone is pregnant. And so they can have their questions answered there, as well as help with identifying potentially a PrEP provider in their area.
Awesome. And Rymsky, can you tell us more about the She's Well initiative with CDC?
Well, it's an initiative to actually, like Dr. Blackstock said, for the prevention part of the campaign, and to educate people more on PrEP and what is available, having understanding what PrEP is, and being able to get themselves into care to get PrEP so that they can prevent themselves from acquiring HIV. And I also want to mention, with that, before I was diagnosed, I was telling them, even after I got diagnosed, I didn't even know PrEP was available. And that, alone, just being a Black woman in Mississippi, uh, I didn't even have the education on PrEP, didn't even know PrEP existed. That I was like, if I had known anything about PrEP, I would have, of course, gotten on PrEP, because I knew that I was a woman that was involved in loving relationships like any other woman. that wants to be involved in a loving relationship with a man. And so, so PrEP is one of the biggest things that I'm excited about right now that's going to help women to prevent them from acquiring HIV and to bring the numbers down, and so that we can have a better and a healthier world, uh, that people can go on with their lives and not have to worry about HIV. And I'm also, of course, glad that now we have better services and more, technology and things that advances for people with HIV, that we can live a longer life as well.
Mm-hmm.
Exactly.
Yeah, and just to piggyback again on what Rymsky was saying, like PrEP, for women, it can be something that's really empowering, to be able to like take control and be able to protect one's health. And so, often when we talk about HIV, it can be in a really negative, like risk framed way, trying to scare women into taking PrEP. But it could be something like, these are different tools that are available that allow you to have control over, your sexual health, and to, potentially decrease your risk of acquiring the HIV infection, for instance. So that can be just sort of flipping in the positive, because many women may not see themselves at risk for HIV, but for instance, also if it's talked about with OB-GYN, that many women may be concerned about getting preventing pregnancy versus HIV. But if an OB-GYN is talking to a woman about preventing pregnancy, they can also mention, and there's also this tool that you can use that can allow you to protect yourself as well.
Yeah, I think that would be very helpful. A lot of women do trust their OB-GYN. So, yeah, and Dr. Blackstock, like, I'm wondering more about like women that should really be on PrEP. Like, who should that be targeted to?
So there are guidelines around who would benefit the most from PrEP, but typically, women who are sexually active and may not know their partner status, HIV status, or who may be engaging in condomless sex. Those individuals might be at increased risk for acquiring HIV infection. But the reality is, like, if someone just is concerned about HIV and they're sexually active, like that's enough reason to let go and talk to a provider about whether this could be a good fit for them. Many women, for instance, are affected by intimate partner violence. So a lot of times people may not always feel safe to say like why they think PrEP, why they are asking about PrEP, or they may not feel comfortable asking about it, whatever. So it's really incumbent upon those of us at community-based organizations and healthcare providers to really make sure that women are aware of this prevention tool. So basically, I would say any woman who's sexually active, honestly, and concerned about acquiring HIV.
Yeah, yeah, that makes sense. And then also, I mean, as we know, like, Black folks, we face all types of barriers when we try to, interact with the healthcare system. So I'm wondering if either of you could like give some tips to people who go and, seek out prevention services like PrEP. If they do encounter barriers, like what should they be looking for and how do they work around that?
I will let Dr. Blackstock go first.
I wasn't sure, Rymsky, I wasn't sure if you wanted to go just as just giving your own experience, as your own lived experience. But also I'll start. So just in terms of navigating the healthcare system, so the system is set up, and it's it can be very challenging, even for someone like myself, to like get around. So I imagine people who don't have healthcare backgrounds, how very challenging it is. And so often what I will recommend is that, if folks are, having a hard time with accessing services and things of that nature, a lot of our community-based organizations have like peer navigators or patient navigators, as well as our healthcare systems have patient navigators that can really help folks with figuring out, what benefits they need, how to coordinate appointments, where to get their PrEP, where to get their HIV medication. So I just have to say, many of our CBOs are like indispensable, and clinics are indispensable partners in helping, people living with HIV or people who are interested in taking PrEP. to navigate the healthcare system. And then also just, I always say, like, someone's seeing a provider for the first time, it can be helpful to bring along a family member or a close friend who can also help to advocate for the individual, so that they're not alone. They can also, like, sometimes things happen and you're like, I don't know, was that just me or whatever? You can have someone that you can bounce things off of and be like, wait, was that a weird, the way that doctor said that? I don't like that. What do you think? So, and then just making sure before you're going to appointments, to the extent possible, that you are, figuring out what are the questions that you want to ask. It can be really helpful, like writing those things down before you go. When we're talking about the topic of HIV and sexual health, sometimes people can get uncomfortable, or providers can get uncomfortable. So it's always helpful just to, like, be prepared to the extent that you can before going into appointments. But the reality is that healthcare systems they're the ones that need to change, and to be able to make the process of engaging and navigating much easier for people.
And to piggyback on Dr. Blackstock and what she talked about, pretty much with community health workers and everything, and that's what I do at this moment as a peer support, because of my experience of when I first got diagnosed and no one came in the room to console me, to even ask me the question, "How are you doing?" I was sent out to deal with it out the door alone. And so from there, it prompted me to become a peer support, to get engaged with women and to show them and teach them how to not only advocate for themselves but advocate for others. And so having a plan, knowing what to the questions to ask, having someone to go along like myself, if they don't have any family members or close friends, they have someone with lived experiences that they can relate to. Because a lot of times, as a woman living with HIV, it's better for us to have somebody with a lived experience. Because even with the women I work with now, a lot of them don't even, their own families don't even know they HIV positive. So being that peer support for me to them helps them to know how to navigate through the health system when it comes to their sexual health, having a conversation with the doctor, knowing what conversations to have with the doctor, and just pretty much advocating for themselves. And so, peer support is a very, very, very essential. And having community health workers that are with lived experience is, this is what we do. um but that's one of the ways that I get women to know that they're not alone in this fight.
Yeah, that's amazing work, Rymsky. So, so necessary, as you pointed out. And just before we wrap up, I just have one more question, mostly aimed at Dr. Blackstock, but Rymsky as well. What recommendations do you have for clinicians and other healthcare workers? You touched on it, just that really the responsibility is going to fall at the feet of those, who have control over these systems. So I'm wondering, what are some of the things that you recommend that they begin doing to start really moving towards equity in this space of HIV?
Well, some of the things that I recommend clinicians to focus on, because of the fact that I have had some experiences with some clinicians, is to focus on, first and foremost, educating themselves more on HIV stigma language, how to communicate with people with HIV, because language is so important in this process, and how you communicate with us. The words matter. The words matter. And so just educating themselves on that more, getting more involved in the conversations with us, getting to know us more. Having those conversations even about sexual health, not being afraid to have that conversation with us about sexual health. It's okay for you to ask me, are you having multiple partners? Have you been with someone in the last week or two? Having that conversation, because even though we may be you're seeing us for HIV, there are still chances that we can be getting other STDs and things are happening. You just don't know. And when it comes to equity, oh my goodness, this is one of the things that I speak a lot about, especially for Black women. Because most of the clinics, because of the history of HIV, and it was all for same gender loving men, a lot of the clinics are only they was only focused on same gender loving men, and so there was not extended services for women when we came into the clinic. Now everybody got the same services for HIV services when it comes to equality, but when it comes to equity for a Black woman, extended services, giving child care on site, if that
Yeah.
if that can make work for you. Providing yearly checkups, getting were we able to get pap smears and all of those things, and that's something new that my own clinic has provided, that now I don't have to go and step out to an OBGYN doctor. I can get all of that and more inside of that same clinic. And so those are the things that I will encourage and talk to clinicians about.
Yeah, that was awesome, and 100% that
Yeah.
100% I agree with everything that Rymsky just said. Yeah, I think it's so important to be able to speak with our patients in a way that is sex positive and non-judgmental, and oftentimes healthcare providers. I think we often feel uncomfortable with a lot of these topics, and so we project that onto our patients, which can then make it a very difficult experience. So really learning how to talk about sexual health because it's a part of our overall health, and asking questions in an open-ended way. So tell me a little bit about your sex life, who does what goes where, and just starting it really open-ended so that you can hear what your patient has to say, what are the terminologies that they're using, and you can use that back with them. Also for providers, like focusing on what matters to your patient as opposed to what's the matter with them. So like a lot of times providers are like pathologizing or making the patient the issue versus really understanding what are the things that my patient is most concerned with. What are the things, so because HIV may not be at the top of many people's lists because they may have many other, they're trying to survive, they're worried about housing, where they're going to get their next meal. So figuring out, what your patient's concerns are, and then how you might be able to sort of wrap maybe HIV testing and prevention and treatment conversations into that. And then also lastly, just being a structurally competent provider, meaning you understand the ways in which these larger contextual, social, structural factors, like we mentioned, racism, lack of having Medicaid in southern states, how does that impact the experience of your patients? How does that place them at maybe an increased risk for HIV or sexually transmitted infections? How might it make it hard for them to engage in care or take their medication? So really having that 360 holistic view of patients is incredibly important.
Exactly. Yeah. Thank you so much for really great feedback and suggestions for providers. That's so important. It definitely cannot be all on the individuals to make this happen. So, Rymsky, where would you like people to find you?
I would like people to find me. I have multiple, but you can find me on Facebook at Rymsky.Evans.31, and on Instagram you can also find me at b.loved_inc underscore ms, and my last one on Instagram is royalty_by divine.
Mm, love it. And Dr.
Awesome.
Blackstock, you as well.
So I can be found on Twitter at Oni_Blackstock. And then for the audience, if you're interested just in getting more information about HIV prevention and testing and treatment, you can go to cdc.gov, stop HIV together to get more information. And then if there are any providers watching, there's also the Nexus page, which I believe there should be also links on the cdc.gov page where you can get more information in terms of resources for clinicians.
Great. Okay. Well, thank you both so much. I really appreciate you both taking the time to be here. So we'll go ahead and we'll have our second poem from Ashlee just to close us out here.
Yeah, thank y'all. Thank you all. And thank you all so much for that information. Like some of that stuff I hadn't even considered. So this has been dope to me. And so I'm going to end this poem with a celebration poem about women and femmes and all of the ways that we show up in the world and all of the work we do. This poem is called Hymn, Hymn, like a song, because I thought we deserved our own. Come through, eyebrows. Yes, highlight. I see you braid out. I have posted another selfie on Facebook, and Black women are doing what they do best, making me feel more visible than I have ever been. And I say, lean in. Let me tell you of a wallless church, a congregation of women in the business of saving women who, when given the trash and the broken, have refused to think you disposable women who do the heavy lifting while the world watches from the sidelines, women who serve as a second womb for the motherless, or sometimes for grown people intent on not doing their own emotional work. And we let you bask in the greatness that is, should you be so lucky to be granted this magic, because we might side eye you to kingdom come, might roll our eyes until you poof and disappear. And ain't that sorcery? The way our defenses protect us from the elements, from a winter of the undeserving, intent on getting all of our harvest. And you so vain, you think we do this for you. As if we wake up in the morning pandering to the world's gaze, as if the women of Alabama and Wakanda have nothing better to do than to save men from themselves. Lean in. We save ourselves first, and you get saved in the process. And ain't that the way it always goes? We get dressed in all the work we do, and you are saved just by touching the hem of our garments. Black queer women create social justice movements, and you make it about people oblivious of their own privilege, who demand we be Black first and woman when it suits them. Our intersectionality is a myth. Misogyny is a weed that grows back no matter how many think pieces you spray on it. The trouble with being the savior, though, is people don't usually think you need saving. They don't think you need gentleness. To the women I vow to be more gentle, know that you are worthy of someone who helps you with the work. Too long we have dined with the world, serving food from our own gardens on tables that we bought and built. All that I have, I owe to Black women. And here I say glory to the women who thought I was worth saving. Glory to the women who think I'm enough, even on days when I fall short. I say, come through, eyebrows. I say, I see you. You be visible, and you be worthy of all this praise. Thank you all so, so much. It's been an honor.
Thank you, Ashlee. Come through, eyebrows. That was beautiful. Bye, Ashlee. Again, thank you to our esteemed guest speakers, Dr. Oni Blackstock and Rymsky Evans, and thank you to Ashlee Haze, and thank you to you, our viewers. And I also want to thank CDC's Let's Stop HIV Together campaign. And I encourage anyone who is seeking more information and resources to go to their website, which is cdc.gov/stopHIVtogether. Or you can find them on social media at Stop HIV Together. And also the hashtag She's Well is an initiative that you can check out to learn more about how to access PrEP. And of course, follow Black Health. It's at BLKHLTH on everything to keep up with us and everything that we've got going on. We'll definitely be having more of these conversations, and we have a lot of work planned for this year. So we really are glad that you joined us today, and we hope you stay engaged with us forever. So thank you. Bye.